I graduated from the School of Public Health in 2005, and I was in the Environmental Health Sciences department, and I majored in toxicology, and I earned a PhD. And these days, I'm a toxicologist at Medtronic in Minneapolis. When I started there, they said a patient received a Medtronic product every 4 seconds in the world. And last year, my favorite metric is 1% of the humans on Earth received a Medtronic product. But what I do is I work with research and development people, create products that are safe from a toxicity perspective. If there's a question on paper, if we think there's some risk based on the amount of a particular chemical or numerous chemicals that are extracted from a device, then we can go and run either some cell-based tests like cytotoxicity or genotoxicity, or we can run different animal tests, irritation, sensitization. But we're striving to avoid animal testing. My advisor, Bill Toscano, used to say the kill 'em and count 'em world of toxicology. And you're seeing this around the world. The cosmetics testing ban in Europe went into effect a few years ago. The state of California has just banned animal testing for cosmetics and consumer products. And by 2035, EPA will not accept animal data anymore, and they will not fund any more animal testing. So this is real. This isn't just some pipe dream thing. This is happening around the world, and it's not just in medical devices. It's in consumer products. It's in drugs and environmental work too. So that's been my part-time mission, and a lot of it has been on my time at nights and weekends to get this to happen. But striving to replace some of these routine animal tests with human tissues or human cells. And so the thing about the rabbit test is it's maybe 50 to 60% accurate. So it's not much better than flipping a coin. Consuming tens of thousands of animals every year. And I just thought, well, there's got to be a better way of doing this. And that's why I pursued this project to use 3D human skin as a replacement for the rabbit test. ISO committee decided to support this validation study. They call them round-robin validation studies. We created over 2,000 samples that had irritants in them, and these are all blinded samples, and they were coded and shipped to these labs around the world. And they had to run these 3D, it's called reconstructed human epidermis. I just call it 3D human skin because it's living human skin. Guess what? 95 to 99% of the time, these companies got all those blinded samples correct. And here on September 1st, there's a new ISO standard. It's called ISO 10993-23, irritation testing for medical devices, and it specifically says 3D human skin is the new preferred method for doing irritation testing for medical devices instead of the rabbit test. But the whole goal is to help develop devices faster, ensure that they're safe, and also reduce the needless use of animals. Been involved with the mentor program off and on and helping different students, and I'm on some thesis committees with grad students, and to pay it forward, to give something back to the university, to help students, to help train future toxicologists, because there's a big demand for toxicologists. And if I can do that and do my job at Medtronic and then do my hobby, which is alternative testing, then I'll feel like I've made a difference in the world.